for fall prevention, the big picture. This is part 3 of the 4-part series all about comprehensive fall prevention. And today what we're going to be talking about are activities. So why how we do what we do matters when it comes to falls and independence and fall prevention. If you're just joining us, if this is the first part of the series that you have seen, then let me introduce myself. My name is Emilia Bourland. I'm an occupational therapist. I also have my executive certificate in home modification from USC's Leonard Davis School of Gerontology. I'm a former educator at Texas Women's University, and there I taught advanced clinical reasoning and hands-on clinical skills. I'm a published author and an expert in fall prevention, and I'm also the owner of AIPC Therapy, which is a mobile occupational therapy practice. We're absolutely dedicated to helping seniors live the highest possible, safest, most independent quality of life. So with that, let's talk about you and why you are here. So if you're here, it's likely that maybe you have experienced a fall personally, or with a patient, a client, or a loved one. You're worried about safety. Maybe you're confused or you're unsure about what works and what doesn't work when it comes to fall prevention. Perhaps you've been let down by past fall prevention programs or education. Maybe you have concerns about liability due to client or patient falls. You need evidence-based solutions. And above all, you're here because you care about doing what's best for you, your loved ones, your clients, and your patients. This training series is best for families, individuals, and professionals who value safety, who want to foster independence, who want comprehensive solutions for fall prevention, and who want high impact strategies. Before we get started, this is a general fall prevention training program. It is not a substitute for individualized fall prevention intervention training or programs. So if you or a loved one or someone that you're working with, you think needs an individual fall prevention program, needs treatment for a health or medical condition, then please reach out to a licensed healthcare provider such as myself or another professional in order to get the help that you need. So we're going to start again by just defining what is a fall. Forgive me if you've watched the other parts of the series, but for folks who are just joining us, this is an important thing to go over because it's important to capture all of the falls that are really occurring in our places of work, in our homes. So a fall is an uncontrolled descent to any surface or any attempted movement that ends up on the floor when the floor was not the goal surface. So often in healthcare, we define a fall as when someone actually hits the floor or ends up on the floor. But really and truly, if someone is falling in an uncontrolled way into a chair, onto a bed, those are also falls. And we need to think of them that way so that we can act in our own or that person's best interest to be proactive and prevent them from having a serious fall that does have a serious injury. So some myths about falls. And these I want to carry through the whole series because I think it's important to identify them, to call them out and make us all aware of them. And the first one is that falls are just a natural part of getting old, that they're inherently related to age, and that we're all should just expect that we're going to fall as we get older. And that is absolutely not the case. The second myth is that it's okay if someone is falling, as long as that person hasn't been getting hurt. It's really truly only a matter of time before someone does get injured from a fall. So if someone is falling, it's time to step in and intervene now. The third one is that the best thing to do to prevent a fall is to immobilize the person who's been falling. I can tell you absolutely 99% of the time that is the opposite. That's not the case. In fact, when you try to immobilize people who have frequent falls, they're going to end up falling more often. And the injuries that they sustain when they're falling are generally going to be more severe. So we want to try to avoid that whenever possible. So this is our long list of why falls happen. And highlighted in green here are the ones that we're kind of going to be going over today. So changes in activity levels that lead to changes in the person. These could be muscular, balance, or cognitive changes. Also, we're going to talk about unsafe habits or practices, nutritional deficiencies, medication issues, and equipment that's not used correctly or is poorly understood. Those are all sort of the activities realm of why falls happen, and it'll make more sense as we go through here. So why does the way that we perform activities, why does that matter for falls and for fall prevention? So I'm going to start as usual with a story. So this is about a woman in her 70s. She was pretty medically complex, had a lot of comorbidities. She lived at home with limited support. And she was having some increasing problems with bed mobility. She was starting to fall out of her bed when she was trying to move around in it. And at first it was kind of unclear why that was happening. And when I went and saw her, it became obvious that it had been her habit since she was a child to crawl into her bed face first. So she would kind of climb into bed face first. Because of the physical factors that were going on with her at that time, she didn't have the strength or the balance to do that. And so she was falling out of the bed at that time. So what we did is I trained her in simply a different way to get into the bed. And the outcome of that specific intervention was that she stopped falling out of her bed. She reported an increased ease of all of her bed mobility and all of her transfers because she was able to generalize that training to other aspects of her mobility. And she had increased confidence in living at home. So the goals for fall prevention, part 3, the big picture is that by the end of this session, I want you to understand ways in which behaviors, activities, and habits can influence fall risk and maybe these are things that you had forgotten about or were previously unaware of. I want you to be able to identify at least 3 red flag behaviors for fall risk that you were unsure about or previously unaware of. And I want you to understand at least 3 ways to decrease fall-related behavior, habits, or activities. So how do behaviors, activities, and habits influence fall risk? So here it is, the short and sweet. What we do or what we don't do creates change in our brains and our bodies. I'm going to say that again because it's so important. Both what we do and what we don't do creates change in our brains and our bodies. So if you have a lot of movement and activity, that is going to generally lead to good strength, good balance, good proprioception, vestibular maturity. Don't worry, if you aren't in healthcare at all, that's fine. I'm going to tell you exactly what those things are in session number 4. And also can lead to increased reaction time. If someone, on the other hand, lives a very sedentary lifestyle, they're not moving around very much, then that leads to a loss of physical and cognitive structures and functions that are required for good balance. It really does come down to use it or lose it. That's very real. Use it or lose it is real, but it's not the only thing. It's not good enough. And here's why. It's because it's not just what we do, it's also how we do what we're doing that can increase or decrease fall risk. So a couple of examples here. Maybe leaning on an unstable chair or table to get into bed leads to increased fall risk. On the other hand, if someone is using a properly selected and installed bed rail or bed cane, then that will lower their fall risk. Think about standing to put your socks on versus sitting down on a chair to put your socks on. And trust me, there are like a million different ways actually that people put on their socks. I've seen lots of different ways that people put on socks. Often we think there's only one way because we have a habit, but there are lots of different ways. And if you think about if you're standing to put on your socks, how much more dangerous is that than sitting down on a chair to put on your socks? So it's a really good example of how the way you do an activity directly influences whether or not it has a high fall risk associated with it. Another one, if someone is using a wheelchair or powered mobility, so if they're locking their wheelchair brakes or turning off the power to that chair whenever they're not moving, versus leaving the brakes unlocked or leaving the power on when they're not moving, that directly affects the fall risk and the safety of using those mobility devices. So what are some other issues about how behavior, activities, and habits influence our fall risk? Medication management. So medications, are they properly managed? This is very much an activity that we have associated with different habits, behaviors, and certainly there's a lot of research demonstrating that it has a high impact on fall risk. So questions to ask about medication management. Can the person take them as directed? Are there physical barriers or cognitive barriers or both to being able to take that medication as directed? Does the person have access to the necessary medications that they need? Do they know how to communicate with their physician about medication questions or concerns? Do they feel empowered to communicate with their physician about medication questions and concerns? Another question is, do habits, routines, and behaviors support good nutrition? There is a great deal of evidence demonstrating that that nutritional issues can also lead to falls. So does someone have the ability to have a good nutrition? What are their habits, their routines, their behaviors? How does it lead into that or not? Can they prepare food safely? Do their eating habits support good nutrition? Can they meal plan and can they shop? All of these things have to be addressed if we're really going to get to the bottom of whether or not someone has good nutrition that supports their health and decreases their fall risk, or has poor nutrition that decreases their health and increases their fall risk. Here are some red flag behaviors that I really want you to be aware of that indicate a high or increasing fall risk. So the first one is nesting. And nesting is where someone basically creates a little space around where they tend to sit most of the day or all day. And in that space, they put everything that they could possibly need so that they won't have to get up. That's an indication that someone is afraid of falling and that they have a high fall risk. Holding on to furniture or walls when someone is walking is a good indication that someone has a high and increasing fall risk. Holding on to towel racks, soap dishes, toilet paper holders in the restroom or shower, especially when getting in or out or during bathing, that indicates having a higher or increasing fall risk. Someone placing their hands on their thighs to push themselves upright when they're in standing, kind of like walking their hands up their thighs in order to get fully upright. Falling the last part of the way into a chair, onto a bed, etc., indicates a high or increasing fall risk. Grabbing onto unsecured items or objects to come to stand. You know, grabbing onto an unsecured chair, an unsecured table, and pulling on it up to stand indicate high fall risk. A small step size or a shuffling kind of when someone is walking, that can indicate a high or increasing fall risk. Rocking several times in order to come to stand, and getting stuck sitting on low or cushioned surfaces also indicates a high or increasing fall risk. So how do we decrease fall risk that's related to activities, behaviors, and habits? Of course, we want to increase movement and activity level by integrating valued or necessary activities into a regular routine, so it becomes part of the structure of the day. We want to arrange the environment in order to encourage safety or encourage the frequency of activity performance. We want to try to retrain, adapt, and modify the way that activities are performed if they're not being performed safely, provide supportive equipment and training, provide supportive supervision for safety if necessary, and rehabilitate lost or weakened skills that can lead to those risky behaviors in the first place. So if someone has a physical impairment that's causing them to grab onto the wall or hold on to furniture, then we want to rehabilitate that weakness as much as we possibly can. And of course, we're going to talk more about that in part 4 of the series, which is dedicated to personal characteristics. We want to address medication management as a comprehensive part of fall prevention. and also nutrition. And that really needs to be done with a multi-professional approach. So we need physicians, nurses, dietitians, occupational therapists in order to do this really successfully and comprehensively. So physicians have to ensure that the prescription is appropriate for that person. Is the dosing appropriate? Are there going to be side effects or interactions that are going to lead to increased fall risk? Nurses, my heroes, I love you nurses, provide absolutely vital education to people about their medications. They help with the medical management of medications, assistance with organizing, scheduling people's medications. They're absolutely indispensable parts of that team. Dietitians for nutrition. Dietitians understand the dietary requirements that people have, and they can make appropriate recommendations based on the personal characteristics of that person, as well as the medical needs of that person. And then you need the occupational therapist as well. And the occupational therapist's job is to help integrate all of that integrate those medications, indicate nutrition into the daily routine, help them to learn to use assistive devices or assistive technology as reminders for taking correct meds on time, ensure physical ability to open medications and get them into their body physically, either with or without adaptations, devices, or modifications. The occupational therapist will be there to retrain, adapt, or modify someone's ability to obtain, prepare, and consume the appropriate nutrition. So, but it really takes, a lot of healthcare professionals working together as a whole to comprehensively manage that particular activity-related fall risk. So let's just wrap up today here. So the ways that activities affect function and safety are pretty vast, and they're really deeply integrated with the personal characteristics, values, and the environment of that person. When activities are performed in a way that increases safety, you're going to get increased independence, reduced falls, reduced stability, reduced healthcare costs, decreased risk of injury and health complication, increased participation and initiation, increased confidence, and of course, higher quality of life. So as you can see, the big picture of fall prevention is a big job. And so that's why there are professionals out there. That's why we have occupational therapists here at AIPC Therapy to help you along this journey, because it is too big a job to take on your own. Occupational therapists at AIPC Therapy are here to help you identify your risks and concerns, to help identify client values and goals, to establish healthy routines, habits that are really based on client-centered values and goals so that they actually want to perform them. We're here to help modify, adapt, and retrain activities, train caregivers to provide appropriate support that actually increases safety, increases participation, and increases independence. And of course, we're here to advocate and facilitate communication with other healthcare professionals. We realize that we can't do everything, and we need other healthcare professionals also to be part of this bigger picture, this bigger plan of fall prevention. And so we're happy to help facilitate that as well. If you need fall prevention strategies, fall prevention solutions, individual training, customized solutions, or staff training, please don't hesitate to reach out. You can call me or email me. My contact information is there for you to use anytime you need it. You can request a free consultation and really find out what are the best recommendations for you? What are the best solutions for you in your situation? What are your options so that you can make the best choice for your situation? If you're not ready for that, of course, you can always go to my website and request more free tips by signing up for my Fall Prevention and Independence newsletter. Just visit my website at aipctherapy.com/fall-prevention for the fall prevention page, and you can sign up right there. It's that easy. And certainly I want you to watch Fall Prevention parts 1, 3, and 4. If you haven't gone back and seen those, oh wait, sorry, this is part 3. My mistake. Parts 1, 2, and 4. So if you haven't seen those other parts yet, then please make sure you check them out, and please watch part 4 as well. Speaking of part 4, it's coming soon. It's all about the person, the physical, sensory, and cognitive characteristics that impact fall risk. What can change, what can't change, and what you can do about it. So this is all about thinking out of the box for fall prevention solutions, being comprehensive, looking at fall prevention from the bigger picture. If you have any questions or concerns, comments, give me a call or send me an email anytime. I would love to talk to you. I'd love to hear from you, and I'd love to help you figure out what the best solution is for your fall prevention problem. Special thanks again to Kathleen Warshawsky and Seniors Blue Book. I'm so thankful to you for giving me a platform to share this vital information with people. I believe that when people are empowered with the right information, then they can make better decisions. And so I'm very thankful to have this platform to share it with. So thank you so much. If anyone has questions or concerns, if you need individual programming, customized solutions, reach out via email. You can call me, you can text me. You can request a free consultation anytime and get the recommendations that you absolutely need for best solutions and options for you. Want more free tips? Sign up for the Fall Prevention and Independence newsletter on my website on the Fall Prevention page. And of course, watch Fall Prevention, the Big Picture, parts 1, 2, and 4. My goodness, apparently I had a lot of trouble making these slides. I couldn't count anymore. Okay, but anyway, it's been wonderful. Thank you so much for watching and listening. I can't wait to share the next session with you, and I will see you soon. Bye.
Thanks, Emilia.